In this video, you'll hear a health department interviewer conducting an interview with Travis Garcia, a resident of Broome County who has been diagnosed with a Shigella infection. This video models how to navigate asking sensitive questions, such as the sexual history questions, during an interview. Before beginning an interview, be sure you are familiar with the pathogen, interview form, including any sensitive questions, and the reason for collecting this information. Hello, may I speak with Travis Garcia?
Yes, this is Travis.
Before asking sensitive questions, make sure the case is in a private, comfortable space. If they are not, encourage them to relocate before continuing. Okay, Travis, for the next set of questions, it might be helpful to make sure you are in a private, comfortable space, just because these questions are more personal in nature. Are you in a private space now, or would you like a few minutes to find one?
Yeah, I'm by myself. What kinds of questions are these?
Be sure you introduce sensitive questions using a professional tone and remind the case that their responses will remain confidential. If there are situations in which limited information may be shared, be sure to explain this to the case as well. Well, one of the things we know about Shigella is that it can be spread through sexual contact, as well as the other forms of transmission we had talked about before. I'm going to ask you some questions here about your sexual history, except for in some very specific situations where we would need to prevent any further spread of illness, such as during an outbreak. Any of the responses you choose to provide to these questions will be kept completely confidential. Is it okay if I continue?
Okay, I guess that's fine.
Great, I really appreciate that. Let me just start with the first question here. During the 7 days before your illness, did you have any sexual contact?
Yes, I think I would have had sexual contact with my boyfriend that week.
When addressing sensitive topics, avoid making assumptions based on responses to previous questions. Okay, got it. Can you tell me the gender identity of your partner or any partners that you might have had sexual contact with during those 7 days before your illness?
My boyfriend identifies as male.
Okay, great. So let's pull out a calendar here. So just to be clear, those 7 days before your illness would have been March 13th through the 20th. And I know you mentioned that you may have had sexual contact with your boyfriend. Do any other sexual partners come to mind during that time?
Yes. Okay, now that I look at the dates, so I definitely did meet a new guy that week. It was just a one night thing. This honestly, this feels really intrusive to have to share this with all of you.
If a case is hesitant to respond when asked sensitive questions, restate why you are asking these questions and remind them that their answers will stay confidential. I understand that these can be really sensitive questions. I'll just remind you that we ask you these questions because Shigella can be spread through sexual contact. And our goal is to avoid any further spread of illness and also to make sure that if your partners do become ill, that they can go and get tested for Shigella. I'll also remind you that unless it is an outbreak situation where we need to stop further potential spread of illness, any responses you provide will be kept completely confidential.
Okay, fine. I guess it's okay. What was your question again?
Even with sensitive topics, it is important to gather enough information to determine whether others may be ill. Probe further as needed to gather this information. During those 7 days, so March 13th through the 20th, before you started to feel sick, did either of your sexual partners mention feeling ill with similar symptoms to you, like diarrhea or abdominal cramping?
No, nothing like that.
As far as you know, have any of those sexual contacts mentioned anything about becoming ill since that time?
I don't know about that guy from the bar, but my other partner has been feeling fine.
Great. So, if either of your sexual partners does mention having symptoms, anything like diarrhea, fever, stomach cramping, or other symptoms, we'd recommend that they reach out to a medical provider and ask to be tested for the Shigella infection. Make sure to provide the case with education regarding prevention methods for illness spread. Ask if they have any questions and address those questions as needed.
Okay, I can definitely let them know to do that. I haven't talked with the guy I hooked up with afterwards, but I guess I can just send him a text just to make sure he looks out for this stuff.
Great. I would really appreciate your help with that. Those are all of the questions that I have for you right now, but I did have some information that I'd like to share with you about preventing any future spread of Shigella infection. Would it be okay for me to go through that with you?
Yeah, for sure.
Great, thank you. So, like I mentioned before, Shigella infections can be spread through sexual contact. And specifically, this type of spread happens when someone puts something into their mouths that is contaminated with Shigella bacteria, which can be found in stool. So, this could be someone's hand, food items, or any other objects that might be used during sex that have had any type of contact, even a really small amount, with fecal matter. So, as soon as that object has had contact with someone's mouth, they would also be at risk for infection. Do you have any questions about that so far?
No, that makes sense.
Great. It is also possible for illness to spread even after you start to feel better. So, we advise that all adults wait to have any vaginal, anal, or oral sex for at least 2 weeks after you no longer have diarrhea. Ideally, we would recommend waiting even longer because Shigella germs can stay in the stool for several weeks. However, if you do have any sexual contact during this time, it is very important to do anything you can to prevent the spread of bacteria using other methods. So, this would include things like using barrier protection, like condoms or dental dams, as well as maintaining good hygiene practices during sex. So, that's including you and your partners washing your hands with soap after using the restroom, before and after sexual activities. It's also important to clean and disinfect any objects that you use for sex after their use and before switching which person they might be being used with. So, again, you would need to practice these steps for the next few weeks until the Shigella bacteria are no longer being shed in yours or anyone else's stool.
Okay, thanks for all that helpful information.
Absolutely. Do you have any questions about these recommendations? Anything I can explain further?
No, that all makes sense. Thank you again for everything.
Of course. Please feel free to reach back out to me if you have any other questions or concerns that come up. And again, thank you so much for your time today and also your willingness to go through that interview with me. Before beginning an interview, be sure you are familiar with the pathogen, interview form, including any sensitive questions, and the reason for collecting this information. Before asking sensitive questions, make sure the case is in a private, comfortable space. If they are not, encourage them to relocate before continuing. Be sure you introduce sensitive questions using a professional tone and remind the case that their responses will remain confidential. When addressing sensitive topics, avoid making assumptions based on responses to previous questions. If a case is hesitant to respond when asked sensitive questions, restate why you are asking these questions and remind them that their answers will stay confidential. Even with sensitive topics, it is important to gather enough information to determine whether others may be ill. Probe further as needed to gather this information. Make sure to provide the case with education regarding prevention methods for illness spread. Ask if they have any questions and address those questions as needed.